endoscopy shared decision-making. We introduce the gastroscopy and colonoscopy process through the following video. In addition, we help you to find out your preferred choice. Awake or painless endoscopy, we hope that you can make the best decision through our explanation. When do I need to undergo gastrointestinal endoscopy? Gastroscopy is recommended in stomach discomfort caused by diet. Colonoscopy is recommended in bloody stool, long-term diarrhea, constipation, or high risk of colorectal cancer. In addition to the above conditions, you need to undergo gastrointestinal endoscopy if you meet the following criteria. What is the purpose of the gastrointestinal endoscopic examination? Early detection and early treatment of the diseases is the main goal. If polyps are found during the exam, excision or biopsy will be done. The process of gastrointestinal endoscopy, gastroscopy usually takes 10 to 20 minutes. Please lie on your left side. Local anesthetic may be sprayed into your mouth. The scope is inserted through the mouth to the stomach. You need to swallow. Colonoscopy usually takes 20 to 30 minutes. Please lie in supine or lie on your left side. The scope is inserted into the anus. Air is inflated through the scope. Please keep and change your position by doctor's order. After understanding of gastrointestinal endoscopic exam, if you are expected to fear and worry during a wake exam, you may consider painless endoscopy. Painless endoscopy is to receive exam under sedation by intravenous anesthetics and analgesics. Your vital signs will be carefully monitored. You will be unconscious and pain-free during the exam. May I receive painless endoscopy? Sedation? Sedation is not suggested. If you have following risks such as BMI greater than 35, older than 75 years old, heart or lung disease within 6 months. All sedation for painless endoscopy must be done after careful evaluation by anesthesiologist. The next steps can help you make a choice in awake or painless endoscopy. Step 1. Understand the advantages and disadvantages of awake and painless gastrointestinal endoscopy. Awake endoscopy without sedation. Advantages. You will be awake and can discuss to physician during the exam. You can go home immediately after the exam. Disadvantages: 1. Nausea. 2. Arrhythmia or high blood pressure due to anxiety and fear. 3. Possibility of discontinuing exam. Painless endoscopy under sedation. Advantages: pain and anxiety free during exam. The doctor can examine the disease more detailed. Disadvantages: evaluation for sedation. Preparations such as fasting, blood sampling, chest x-ray, and ECG must be home with accompanied. Step 2. Before you decide to receive endoscopic exam, what do you care about? First, pain assessment. According to your experience, which degree of pain can you tolerate during exam? If you are less tolerant to pain, you may consider painless gastrointestinal endoscopy. Next, please thinking about what is more important to you. If the time and cost not become a burden to you, then the painless endoscopy is the option of your choice. Step 3. Do you understand the advantages and risks? Here are some quiz that remind you of important questions. Step 4. Are you ready to make a decision? If you still have any question, it is welcome to ask to our staff. We will explain once again to you. Preparation of painless endoscopy. First, know instructions and questions of the exam. Second, complete the consent form. Third, complete the anesthesia counseling. Fourth, keep position for the exam. In precaution before painless endoscopy at night before exam. Please fasting at least 8 hours, including cigarettes, betel nut, and water after the last laxative at exam day. Please remove movable dentures, metal ornaments, makeup, nails polish. Contact lenses into the room. Please pee yourself. Put on surgical clothing into paper cap. Accompanied by an adult is necessary. Routine precaution about medicine before gastrointestinal endoscopy. Polypectomy may be done during the endoscopy. Please discuss to your doctor about discontinuing anticoagulant drugs. If you cannot stop it, polypectomy is not suggested. See diet before colonoscopy. The purpose of diet control is to strengthen the bowel preparation before colonoscopy and to improve exam quality by cleaning stool in the intestine. The principle of diet: first, low fiber diet from 3 days before the exam. Second, liquid diet only at the day before the exam. Third, please avoid all fired food as following recommended menu. Low fiber diet recommendations: please avoid milk and its products, fried food or fish. You can choose steamed or boiled eggs, soy milk, tofu, porridge, noodles, toast or fruit juice. In pre-exam preparation: first, put on surgical clothing and special pants. Second, an intravenous line will be set up in waiting area. Third, please move to the table 20 positioning gastroscopy. Lie on your left side. Colonoscopy: lie down or lie on your left side. Preparation for sedation: check identity, procedures and setup. Physical monitors begins intravenous anesthesia after position. Sedation for gastrointestinal endoscopy: anesthesiologists and nurse anesthetists will care of you during sedation. We will give you intravenous anesthetics and monitor your physical signs: respiration, heart rate, blood pressure, oxygen saturation, to ensure your safety. When gastrointestinal endoscopic examination is complete, phase 1 recovery is in the recovery room. It usually takes 20 to 30 minutes till you are awake and can stand up. Phase 2 recovery is in the observation room. You can go home after you can walk alone. Precaution after sedation for painless endoscopy: common discomfort after sedation is mainly nausea and vomiting. Please drink some water. If there is no discomfort, you can try a light meal. After the end of sedation, it is not recommended to engage in dangerous or fine work, such as driving, drinking, or signing documents. Education after gastroscopy: for gastroscopic exam, please drink water or eat after 30 minutes because your throat is still under anesthesia. Please do not cough or clear throat with effort. If tissue biopsy or H. pylori test was done, please avoid intake hot, hard, or irritating foods such as sour, spicy, cigarettes, wine, coffee, tea, and so on within 2 days. For gastric polypectomy, in addition to the above precautions, please eat smooth food and chew slowly. Avoid irritating, fiber-rich, roughage, and hard food. Please do not exercise extensively and lift heavy objects within a week. If you suffer from persistent abdominal pain, tarry stool, dizziness, low blood pressure, pale, rapid heartbeat, and so on, please visit emergency room immediately. Health education after colonoscopy: for colonoscopy, you can eat after exam if there is no flatulence or discomfort. If you have bloating, please walk around or use menthol packing to relieve abdominal distension. For colonoscopic polypectomy, in addition to the above precautions, please avoid anticoagulant drugs within 7 days. Do not eat roughage, irritating foods such as peppers, garlic, mustard, tobacco, and alcohol within a week. Please do not exercise extensively and lift heavy objects within a week. Keep soft stool by intake more water, at least 1,500 cc within a week. If any of the following occur within 48 hours after a colonoscopy, consult a doctor immediately. Passing a lot of blood from anus, low blood pressure, pale and rapid heartbeats. Telephone consulting: if there is any question about anesthesia or endoscopy, you are welcome to call. Here are some quiz to remind you of important issues. After watching the above videos, we believe that you have a primary understanding of the gastrointestinal endoscopy. We hope to help you choose a suitable method after realizing awake and painless endoscopy by shared decision-making. Please check the following items and let us know your satisfaction.